The work that you do in hospice is so important, yet far too often, hospice and palliative care services are included in the medical plan at the very end. Has that been your experience?
Yes, there's reluctance to refer on the part of healthcare providers, physicians, and then also there's a reluctance to embrace the hospice care on the part of the patient and the families. Half of our patients die within a month of being admitted onto hospice, and a quarter of them die within a week. And the pandemic has made that much worse. There have been so many restrictions.
But even before the pandemic, there was a reluctance to refer.
Yes.
Why do you think that is?
People, I still think, have the wrong impression about hospice that it's only for when you're within a few days of death. And I think they also think it means that it's giving up hope and giving up everything. I think one of the worst things we can tell a patient who is at the end of treatment options is to say, there's nothing else we can do. Because I am here as a hospice nurse to tell you, there is always something we can do. Even when we've given all the medications, you've had every discipline come to see you, we've got oxygen, we've got a catheter, we've got everything you need. There is always something that I can do. I can sit there. I can be with you. Even if you don't want to be touched, I can match my breathing to yours so that you are not by yourself. Mm-hmm. There is never nothing more we can do.
And I can manage your symptoms. You don't have to suffer.
Absolutely.
I can control your pain. I can control your vomiting. I can increase the amount of quality time you have with your friends and loved ones.
Yes.
So given this hesitancy that healthcare professionals have in terms of involving hospice and palliative care services early, what are some ways that we can address that?
The word that comes to my mind is upstream. Let's have those conversations about hospice care upstream, earlier, way earlier. We should be talking to younger patients. We should tell them this is part of a disease trajectory. There is home health care, there's aggressive care, there's palliative care, which is also another component of healthcare that people are not as well educated about. And then there's hospice care. I think having those conversations earlier, talking honestly about what they are and what we do in hospice.
You mentioned home health care, you mentioned aggressive care, you mentioned palliative care and hospice. Could you walk my listener through what's the difference?
So you see it as a sort of a continuum for a person in their healthcare trajectory. As we grow older and begin to age into the healthcare system, your needs are a little bit more. Maybe you develop a chronic disease where you see specialists. At that point, you may have exacerbations of your chronic illness where you need home health care. Maybe it develops into something where you need treatment. Say you develop a cancer, so you would seek aggressive treatment, which means curative treatment. And then palliative care should be incorporated into all of that, because palliative care, it's about comfort care and quality of life along with receiving treatment. And then once treatment options are exhausted and the disease has moved beyond what treatment can be effective, then you start talking about transitioning into end-of-life care. So there's a continuum.
The other thing that often happens is palliative care and hospice get grouped together, but they're
Sure.
not one and the same.
No. So hospice always includes palliative care because it's comfort care. Hospice is always palliative, but there is a palliative care specialty that you can have before you get to hospice, and it is a growing specialty.
For us, by us, and just for us, this is hope for med.